Today we are talking about looking back 5 years since the COVID-19 pandemic, and specifically some of our coverage that Ozarks First has had in the past 5 years, around late February, early March, before Greene County even had their first case. We're talking about on March 11th, 5 years ago, is when the WHO declared the coronavirus outbreak a pandemic. A global outbreak. So let's play some of those sound bites that I was talking about from our coverage from early March 5 years ago.
Washing my hands more constantly, wearing gloves at work all the time.
Sometimes, especially at church, you hug people or shake hands, and I try to discreetly use my hand gel after that.
This outbreak could still go in any direction.
So we know that there are some unknowns. We know there are some things we don't quite know about this virus yet.
As governor, I have no greater responsibility than to keep all Missourians healthy and safe.
The health department saying that these are unprecedented times. There are still a lot of unknowns. And I think for me, getting that interview with the Springfield-Greene County Health Department spokeswoman was kind of the moment that I was like, if they don't have the answers, what is going to really happen?
Just the unknowns of it, yeah. And at this point, there was even guidance coming out from lawmakers on the national level saying this will not be anything. When this first case happened in California, we will leave it at this. But it was told to us that, hey, one or two people are gonna get this. It's gonna go away, and by the end of March, it was gonna be 0 cases and will have been a memory. That didn't happen, and it very quickly changed from that.
No, and one thing that I forgot to mention was on March 6th, there were the 21 passengers on a California cruise ship that tested positive, and that kind of, were the headlines for the next few days, and that's when it got real as well. And now where are we on this timeline? March 7th. So we're working our way up to the 11th. That's when the first case in Missouri was identified. And that for me was just kind of like, it's not if the Ozarks is going to have it, it's when.
Yeah. I think this was the realization of how small the world is, because in years past it might have been easy to think that is way over in China, that is way over in Africa. We're 10,000 miles away. That'll never happen. But I think we got a realization that people travel so much that this progressed so rapidly when we first heard that this was the first cases over there, and how quickly the first case happened in the U.S. and in the Ozarks. People get around. I mean, we travel around the world, and stuff is just constantly being spread. And
that's what was so surprising to me. And looking back, I was naive to think that I thought we were in kind of an iron dome in the Ozarks. Nobody's leaving. Nobody's traveling in the middle of March. Who's doing that? And then once those first cases popped up, you found out, they had just traveled. They were just out of the country.
Exactly.
And so it's just like, it's kind of finding out like your neighbor is I don't know, somebody who you didn't think they were, knowing that it was in our community and we didn't know it.
Or the whole 3 degrees of separation that people talk about, of everybody knows everybody. This is really an example of that, of everybody is connected pretty closely across the world when you think about it.
Absolutely. The 10th, March 10th in Springfield is when the city of Springfield canceled the St. Patty's Day parade, and they canceled it before we even had a case or knew about a case.
And I remember hearing people thinking, do we really need to do that? Are you blowing that out of proportion? That's kind of putting the ox before the cart right there. And there was some pushback, because people were thinking, this isn't going to happen here, but the city officials were like, we're seeing something. We're not 100% sure what's going on, but something's happening, and this is the time to take some precautions. And that's what they did. You can imagine the St. Patrick's Day parade, how many people are out there.
And how many times had it been canceled in the history of it? I'm not sure, but it's just, it was a crazy thing. And I guess the city officials may have had some more wherewithal than the general public of what was happening, but I'm not sure that they really did. It was just kind of all a precaution. And I think they were very right. I mean, can you imagine if they did have that St. Patty's Day parade literally right before?
And there's the balance of, and we know this in the news, of there's information but then you don't want to alarm people. And so I think that's what the health department, I mean, there was something there, but as we've talked about, a lot of times some things don't become something bigger. And so, being aware of it, getting the information out there. We were talking about, the early days of news coverage. We're just going to put one reporter on that because we don't want to fill the newscast with COVID. Well, within a couple of months, the only thing that was going on was COVID. The world was shut down. That's all we had, but it just gives you an idea of how quickly that all ramped up.
And it was overwhelming to be a new reporter. I started on January 1st, and struggling to find story ideas, and then going to every day. Our morning meeting got longer and longer and longer because you were being bombarded with information and real people's stories. People were being impacted every single day, and they were posting it on social media because what else are you going to do when you're not seeing people? And so it's just kind of like trying to grab everything and feeling like every day you weren't able to cover everything. And that was my just feeling overwhelmed constantly by everything, and still wanting to get the information out there, but not knowing who to turn to get that information because everybody was kind of clueless at some point.
Yeah.
Then we come to today, 5 years ago, March 11th, the WHO declares the COVID-19 outbreak a pandemic, and I think that's when everything changed because you couldn't pass the buck anymore. It was here. The health department needed to talk about it, and everybody kind of had that official designation to say it's coming and you need to get prepared.
That was the tipping point.
Yeah.
And, talking about that balance of not wanting to alarm the public, not wanting to blow things out of proportion, but it comes a point where the balance tips because when you realize this is going to be something major, you have to get out there in front of the message, get the word to the people, because if you don't, something's going to happen. This is going to spread. And obviously it did spread. We got the messaging out there, but, you reach a point where this is what it is.
Right.
This is taking over our daily lives.
And we have some sound bites that happened right around this time is when we saw the shelves start emptying out.
Yeah.
Because once the WHO declared the pandemic, everybody started stocking up. Everybody started hearing about there might be stay-at-home orders or things are going to shut down, so you better go get your toilet paper.
I have pictures on my phone right here because I remember going to the Walmart that day for the first time, and it looked like an apocalypse. I've never seen store shelves empty like that, and so I think that's when I saw the store shelves that I realized, okay, we're in for something that's not good. Just seeing that sight.
I completely agree because I think I was on a different story that day. I was working here that day, and all of a sudden the afternoon came around and they said, you need to go to Walmart. You just need to go to Walmart or somewhere and figure out what is going on, and that needs to be your story. So I remember around 2 o'clock in the afternoon, I just kind of walked my way into Walmart with my phone, and because they weren't going to let me in otherwise, and I just took video of whatever I could, and the toilet paper aisle, the bottled water. I tried to talk to people out in the parking lot, and some people were scared. I mean, if you were there, obviously you thought something was going to happen if you're there stocking up, but I got differing opinions, and that's what I'm going to show you now.
Totally out of toilet paper. It's hilarious.
I was trying to find my brand of water in there, and one guy must have had 20 bottles of water in there. So they're stocking up.
People are over everything. I think they're overbuying. I think they're over panicking.
And my husband says it's ridiculous, but I have a daughter in California, and it's very real.
We've had so many threats of viruses and stuff for years and years and years, and this one's just nuts. I mean, it's out there. We need to be aware. We need to take precautions. But this going out of toilet paper is crazy.
Yeah, I think that last lady hit it on the head that we were talking about. We've heard of these things popping up.
That's exactly what you just mentioned at the top here.
Let's be on the safe side. Yeah, it's kind of interesting because it was almost like a double-pronged problem. You had all the people who thought there was going to be a supply shortage because of the pandemic, so I'm going to rush out and, like that lady said, buy 12 flats of water. But then the people that were just going to get their regular groceries wouldn't get any water. So they're like, well, I better stock up because somebody else is going to stock up and get it. And so it was just like a domino effect that really rolled out.
Absolutely. And it was a lot of Uber Eats for me, a lot of DoorDash, a lot of to-go meals, and That was even before we actually had the order to stay home. So that kind of wraps it up for today, March 11th. Looking back 5 years up until March 11th. Tomorrow we'll look at March 12th. We can tell you now that was the first time a case was confirmed in Greene County.
Yeah.
So we can talk about what happened then and what happened after that, and the stay-at-home orders that followed, and we'll show you that some of that coverage, and hopefully my sound bites will work better.
Hey, well, we'll figure it out, and we want to hear from you guys. Obviously, we all have memories. This is sort of like for our generation, the "where were you on that day"
Exactly.
kind of a thing. And so
Exactly.
we'd love to hear your memories and your comments. We're going to be talking about this for a couple of more days, kind of rehashing what happened. It's interesting that in a span of a few days, we're taking 3 days to talk about it because there's so much.
There's so much.
But go ahead in the comments section down below. Let us know your thoughts about what you went through, and in a way, it's a good thing that it is 5 years later. A lot of bad stuff happened,
Yeah.
but we made it through. We are here to talk today.
And it is nice to know that now we can so easily, we're resilient, and we can so easily put this stuff behind us. For those who haven't been majorly impacted, I mean, I know that people lost loved ones, and people
Yes.
probably are still dealing with the long-term
That is
effects
true.
of COVID-19
Yeah.
sometimes.
Yeah.
But as far as our coverage and everything, we're no longer in this tunnel vision of COVID-19, and we can kind of take a step back and breathe a little bit and know, okay, we lived through this, and it's going to be in the history books one day, and we were there, and we saw it every single day. One thing I didn't mention, we can talk about it tomorrow, was we never worked from home. So we'll talk about working from home and
Yes.
stuff like that. We came in every single day
Yep.
with our masks on, ready to go out and talk to people who were probably infected
Yeah.
at testing sites and stuff like that. But you had to do it, or else
Yeah.
you weren't going to get the information out to the people.
That's
So.
the way the news is when most people are needing to stay home for something. That means we're needed more than ever because something's going on that they need the message about. So,
Exactly
yeah.
right, and I'm proud of our coverage from back then, so I'm
Absolutely.
excited to continue to keep looking at it. But we'll wrap it up today. Thanks for joining us. Bailey Strohl here with Mike Landis, and we'll see you again tomorrow.
Have a great one.